Hello everyone, my name is Sarah Ordonas, and today I will be informing you on why the American healthcare system does not compete with universal healthcare. Did you know that the number one reason people file for bankruptcy in America is due to medical bills? CNBC estimates that over 65% of all bankruptcies are tied to medical problems. According to the Center for Medicare and Medicaid Services, the average person spends $11,000 a year on healthcare. This accounts for about 18% of our total GDP, or the amount of money Americans spend on American products and services. As a public health major, a large part of my educational training is understanding the current medical system. Public health research often looks at the main causes for poor health. The privatized medical system in America makes it unnecessarily harder for people to get necessary medical care. In this speech, I will inform you on the differences of America's healthcare system type and the National Health Service System. I will also compare the outcome differences for privatized healthcare systems and universal healthcare systems. Lastly, I will address the financial aspect of universal healthcare and compare it to American healthcare spending. I hope by the end of this speech, you will better understand the downfalls of our current healthcare system and better understand the fight for universal healthcare in America. With the amount of money we spend on healthcare compared to places with non-privatized healthcare, you would expect our outcomes to be better, but they're not. Looking at outcomes is very important in determining the effectiveness of a healthcare system. Some types of outcome researchers look at is life expectancy, rates of people going to the hospital, rates of people who return to the hospital after being treated, and maternal mortality. According to a study done by the National Institute of Health, we have a shorter life expectancy than most other countries that provide universal health care. Furthermore, America has consistently had the highest amount of obese populations compared to many other countries. We also have more cases of lung disease and death from lung disease than other European countries like the United Kingdom. The United Kingdom has more primary doctors, offices, and hospitals, meaning that citizens have more access to health care, leading to them having better health. Furthermore, America has almost double the amount of mothers dying during childbirth than the UK, according to Dr. Van Doren. We also have the highest number of babies dying during delivery than the UK. Baby and mother deaths are a very strong indicator of the healthcare system, and our statistics consistently show that we are behind in numbers and lacking in adequate healthcare. But just because our healthcare system does not have better outcomes does not mean we pay less. In fact, we spend more money on healthcare for far worse outcomes in America. As previously stated, the American GDP is 18% is spent on healthcare. America's healthcare is very complicated and has many different definitions and unnecessarily complex jargon. Most private health insurance system agencies require the payment of premiums, which is the amount of money that you have to pay for the policy. However, sometimes employers pay this fee or part of it. Sometimes private health insurances have deductibles, or the amount of health care costs that the customer pays themselves before the insurance company will pay anything for any medical care. Another fee that customers have to pay in private health insurance is copay and co-insurance, which is the amount a person has to pay out of pocket for prescriptions, clinical visits, clinical tests, and more. The fees get very costly very fast, and as consumers, we're often left confused as to why we have to pay these unnecessary medical bills and fees. In national health service systems, the payment programs are very different. When a system is categorized as a national healthcare system in the bone topology, the country's financing must come from the government. This means that citizens in these countries with national health service systems pay for all their insurance costs through taxes. Some countries require copay for prescriptions, but these are usually not very costly. Imagine a life where you automatically have insurance and pay for it automatically through taxes. You know exactly where your money is going and you are directly benefiting from it. Some might say universal health care is unrealistic because it is expensive and will raise taxes far too high than most people are willing to pay. However, as previously stated, many different countries have implemented universal health care already and have not found this to be the case. In America, about 18% of our GDP is used to pay for out-of-pocket healthcare expenses. In the United Kingdom, they pay 9% of their GDP on healthcare, which is approximately half the amount we do. This translates to each person spending less on healthcare. Furthermore, it is automatically taken out and universally accepted. The American healthcare system is overly costly and underdelivers on healthcare results. By comparing America's healthcare system outcomes, system financing, and setup to countries with national health service systems, I hope you now see that America's healthcare system does not work and we need to change. We spend almost double the proportion of GDP on healthcare spending in America than other countries with universal healthcare systems do. Even with spending more, our outcomes are consistently worse. We are not living longer, and it is due to the failure of our healthcare system. We need to change our dated healthcare system and change for universal healthcare. Thank you.